What's up? This is part one of why does my lower back hurt? And in this video, we are going to talk about what pain is and what doesn't cause it. And then in the second video, we are going to get into what actually causes lower back pain. In the third video, we'll talk about what practical steps you can take to improve your situation and get some relief. It's really, really important that you watch this entire video and the next two. If you just skip through and go to another useless top 5 exercises for lower back pain video, then I really can't help you. Like, good luck, and I hope it works for you in the long term. It's not a good long-term solution to just go and watch those videos all day. So to truly make a difference in acute and chronic back pain, it's crucial to understand what pain is, when it's dangerous, when it's not, so that you can reduce the fear associated with that and get back to living your life without fear of re-injury or anything like that. So why even listen to me if you're just tuning in and haven't saw my stuff before? I'm a physical therapist. I've helped over 100 people with chronic back issues. I own a business where this is our primary goal, to help those with acute and chronic back issues live a high quality of life. So I've also watched as family members fell into deeper and deeper depression and disability due to chronic back pain after a severe work injury, and it was just heartbreaking to watch. I've also had chronic back pain too while I played football in college, primarily due to overuse. And honestly, I hate how the current healthcare system is so transactional and doesn't give individuals the information they need, the listening ear that they need, and the multimodal approach needed to truly help those with chronic back pain. So I want to provide education and how-to that makes sense to you so that you can take ownership and have agency in your own recovery, and ultimately to help you regain some control over your life. I think that life should be experienced fully, and that's what I want to help you get back to. And if you don't take the time to understand the why behind your pain, then the how and the what to do about your pain will never give you the long-term relief that you truly want. So why does my lower back hurt? When I type in, why does my lower back hurt, or what causes lower back pain, this is what comes up. Most low back pain is the result of an injury, such as muscle sprains or strains, due to sudden movements or poor body mechanics while lifting heavy objects. Low back pain can also be the result of certain diseases, such as cancer of the spinal cord or a ruptured or herniated disc. Upon reading this, you might think, yep, that makes total sense. If I bend or twist the wrong way or use poor mechanics while lifting heavy objects, then that's definitely a cause, and it is an injury for sure. That's what I think, no question about that. But what if I told you though that this line of thinking is old news from the early and mid 1900s, not like the cancer and whatnot, but the other stuff, and that it's unhelpful, leads to more disability and a lower quality of life? Do you really want to be stuck in that old way of thinking? Honestly, do you want to be stuck in that old way of thinking? I really hope the answer is no. Like, let's jump into the 21st century and leave some of this nonsense behind, okay? So come with me. And yes, there are some instances where this is the cause, but most of the time it's not those injuries and diseases stated above, and there's always context around the pain that we have. So listen in to get more. You still with me? All right. So here's an excerpt I'd like to read about. Many people are dealing with chronic low back issues just in the US. So here's how many. Some 16 million adults, 8% of all adults, experience persistent or chronic back pain as a result and are limited in certain everyday activities. And back pain is the 6th most costly condition in the US. Healthcare costs and indirect costs due to back pain are over $12 billion per year. It's a lot of money. So as you can see, it's a huge issue. And that's $12 billion per year, and that's just on out-of-pocket spending from you and me. Like, when you combine neck and lower back pain together, it's $380 billion with a B. That's more than Jeff Bezos' net worth every year. That's an insane amount of money. Yeah, like that graphic shows. So pain is actually protective. Pain informs us of potential or actual tissue damage and potential or actual danger. Pain tries to protect us from dangerous stimuli to keep us alive. And the frustrating part, though, is that pain is not always associated with true danger. Oftentimes we feel and experience pain even when there is no actual danger or tissue damage. So a way to think about it is pain is like a smoke alarm. So when your smoke alarm is working properly, it notifies you of danger due to a fire and you get to safety. Pain does the same thing. So if you fracture something or experience some other type of trauma, it notifies you that you need help. But our smoke detector doesn't always work so well. It malfunctions. You've experienced it, like you're cooking a delicious meal and an invisible amount of smoke reaches the smoke detector. It trips the smoke detector, and all of a sudden the house is in a panic. Everyone's trying to find a pillow to wave super fast over the smoke detector to turn it off. It's kind of like, you know, you're rubbing a sore spot when it hurts. So just keep this thought in mind as we go through the rest of this video. All right, so here are some common outdated beliefs about what causes lower back pain. And here's a disclaimer, and please listen to this for the love of God. I'm not saying that these things never contribute to pain. What I'm saying is that most of the time there are strategies to improve your symptoms and quality of life, even if you have these findings show up on imaging. And by the way, it's not just more exercise. So if you are triggered by a few of the conditions listed below, please try to suppress that and listen through. I don't ask that you agree with me. I'm actually fine with disagreement, but rather that you would listen with an open mind and try to notice that I'm coming at this from a perspective of fostering hope and ability versus despair and disability, which is unfortunately the standard of care in the US. And I realize that some people are going to listen to this and not be able to grasp the bigger picture, and that really honestly does make me sad. But this is for those of you who truly and are desperately seeking this information. There are a few conditions that I'll share below that are complete nonsense, so you're not stupid for believing these. A multitude of practitioners still peddle in these falsehoods unknowingly and outdated treatment paradigms, but I'm not going to go into full detail into each of the conditions in this article, as it would likely become a book's length, but I'm going to keep it short and to the point, and maybe at some point I may update this video to become more exhaustive. I just said article, but this is the video, so. So number one, bulging disc and degenerative disc disease. These are normal findings. Let me repeat, these are normal findings in most adults. You'll see the graphic up there. Please refer to my first sentence. I'm not saying these things never contribute to pain. And as you can see from this graphic, in people who have no pain whatsoever, these findings are present, so completely asymptomatic. And you might be saying, well, I have pain and I have those findings, so those don't apply to me. Absolutely. I think the disconnect, in this statement above is that providers will tell people, hey, good news, this is totally normal. But then the patient or you thinks, well, okay, if that's normal, then why do I hurt? Like, that's why I'm here. Sadly, the conversation often stops right there, and everyone is just as confused when they first walk into the appointment. So it's like, why did I drive all this way, And there are several reasons, why you hurt, which we're going to discuss later on in this article or video. So the number two is disc herniations or pinched nerves. So large disc herniations can certainly be a direct cause of symptoms, as they may compress spinal nerve roots to a large degree, causing decreased blood flow to the nerve root, resulting in metabolite buildup, which leads to more danger signals being sent up to the brain, resulting in a powerful and painful sensation down the leg. The challenge with this, though, is that not everyone who has compression of a nerve root actually has severe symptoms, and this is why it's important to do a clinical exam prior to getting an X-ray or an MRI. Additionally, the larger the disc herniation, the higher the likelihood that it will resorb and heal naturally with time. Number three, stenosis. Again, this can cause some cord compression, or if it's foraminal stenosis, can cause compression of the nerve roots. But as we discussed above, this can cause symptoms or people can have little to no symptoms. Numero quattro. While it's certainly true that some people who have scoliosis have more back pain, it's also true that most people will be able to improve their symptoms even if they have scoliosis. So in more severe cases of scoliosis where the curve is excessive and causing breathing issues, like surgery can sometimes be indicated. In the majority of cases, a small degree of scoliosis is actually pretty normal. And by making some lifestyle improvements, you can actually reduce a lot of the symptoms if you even have any. This is a common one, back spasms. So lots of people experience these. They are incredibly painful, and oftentimes they come out of the blue from movements as simple as picking up a sock off the floor, sometimes bending and twisting, etc. You know, the interesting thing though is that it's not always from lifting heavy objects. Oftentimes people will experience back spasms in their lower back from doing simple, low effort activities, which, you know, and the cause of back spasm really, again, goes back to our body trying to protect itself, even if it doesn't necessarily have to. Number 6, subluxations or bones going out of alignment. This is complete and utter nonsense that needs to die a fiery death. Can you see how much I disagree with this teaching from so many practitioners? It's simply not true. It's not supported by the research. We can't reliably find differences in bone positioning or bony landmarks between different providers. It is useless. I'm going to link to a few different articles that you can read about this. Just, it's useless, okay? Pelvis is rotated or twisted, number 7. It's just complete nonsense. I mean, the only way for this to happen is with severe trauma or potentially ligamentous laxity with childbirth. So this really doesn't happen, and it can't be corrected by muscle energy techniques or massage or a hammer and chisel. It just doesn't happen, and you can't correct something that is imaginary. I expect to get a lot of hate from this one, even though I clearly articulated in the beginning of this video what the true nature of pain is. You know, it's protective and not do this crap. But I'm going to link to a few different articles that you can read about this as well, okay? Just to give you a better idea. And then leg length discrepancies, number 8, or like my hips are off. It's just complete BS and utter nonsense. It just is. So subluxations, bones out of alignment, leg length discrepancies, or rotations all make a critical error that our body isn't adaptable to various positioning of our bones and joints. And there aren't even any reliable measurements to show these things happening under randomized controlled trials. So, you know, why people get or feel better after getting these things corrected has an explanation too, which is, put simply, it's because people trust the provider and believe that it will help. If there is nothing to correct, but you believe there is something to correct, and then that person corrects it, and you immediately feel better, voila, problem solved, right? The only problem is that most of my clients have had those things done, and they only last for a short duration, maybe a couple days at best. Come on, I mean, so here's what's actually happening with those. So you activate various nerve receptors called mechanoreceptors at the joint level. It sends a non-noxious stimulus to the brain interprets safety, and all of a sudden, to the nervous system, it calms down. This is often temporary, hence why you have to keep going back to keep it at bay. There are other factors, of course, that go into this too, but that's the bare bones explanation. Thank you so much for watching. Part 2 will be released in the next week, going into what are the actual causes of lower back pain. This video was important to watch before that one because it addresses some of the prior unhelpful and inaccurate information you may have been given. So please like this video, subscribe to my channel if this was valuable to you, and turn on that notification bell so you can get notified when the next video comes out. Stay strong, stay resilient, and keep getting after it.